top Republican from the Gang of Six, and I say Gang of Six with the most respect, but that group used to be the Gang of Seven until Republican Senator Orrin Hatch walked away from bipartisan health care talks last month. So what does Senator Hatch say now? Well, let's ask. Senator Hatch joins us live. Good evening, Senator. And Senator, what's the definition of bipartisan? Well, I just had the discussion with Senator Grassley. He says 3 or 4 Republicans join the Democrats. That's not bipartisan. What's bipartisan to you, sir?
Well, we're talking about 1/6 of the American economy. This is a pretty important thing. And I always look at bipartisan bills as somewhere between 75 and 80 votes, both Democrats and Republicans. And one reason why I decided to leave the group of 7 is because, well, there were a number of reasons. Number one, I don't think they've given the Democrats have given Senator Baucus very good flexibility to be able to really put something together. 80 of the top Democrats in the House are insisting upon a government option or a government plan. I can't be for that, and I don't know of any Republican who is really for that. Number two, they want to have some sort of a version of an employer mandate. It's a job-killing approach to the bill. If they do that, then guess who gets hurt the worst? It'll be the low-income workers. They'll either lose their jobs or be cut in pay, or the business will go overseas. I mean, let's be honest about it. It's going to kill jobs. And thirdly, they are doing everything they can to push as many people as they can into Medicaid. Some of the groups have said that as many as 119 million people would be pushed into Medicaid, which would destroy the public insurance industry and the whole program, and we'd be going to what they really want to get to, and that is in increments. They want to go to a single-payer system or socialized medicine. That's what the Democrats are all about, and I just can't support that.
Senator, in terms of negotiating or talking with President Obama, how does it differ with you? You've been in the Senate for a long time, negotiating, talking with President Clinton. What's the difference between these two men in these situations?
Well, you know, I've negotiated with everybody from Henry Waxman, who is one of the most liberal members of the House, to Ted Kennedy, one of the most liberal members of the Senate. I've negotiated with both President Clinton and President Obama. I like every one of them. They had different perspectives than I do, so we try to work together. But when we do, when we put the Hatch-Waxman bill together that created the modern generic drug industry and has saved taxpayers, consumers, I should say, $10 billion every year since 1984 and more today, it was an overwhelmingly supported bill. When we did the CHIP bill, Senator Kennedy and I, the Kennedy-Hatch bill, or Hatch-Kennedy bill it was called at the time, we had a wide bipartisan support for that, and it worked amazingly well until they started pushing Medicaid people into CHIP, and now, again, an incremental step to try and get us to a single-payer system. If we go to a government-run system, I've got to tell you, everybody in America is going to be very sad. Look at Canada. Just this last week, the leading Canadian woman on health care came out and said that situation's ready to implode. They can't continue the way they're going, and that's a single-payer system up there.
If Senator Kennedy is unavailable to vote, and let's say Senator Byrd is unavailable to vote, and the Democrats, though, do have all these votes in the House and the Senate and the White House, is this going to pass?
Well, the Democrats should be able to pass it. They have overwhelming majorities in the House, and they have 60 solid votes in the Senate. The only people they can't control are the American people who are expressing their opposition to these type of things. But they certainly have the ability to pass something. But like I say, there are a lot of Democrats who don't want this government plan, knowing that, look, Medicare is now $38 trillion in unfunded liability. It goes bankrupt within the next 10 years. You know, you look at the budget and the deficits and all the other things that are adding up. We're adding we're doubling the budgetary deficit. You know, the national debt within 5 years, and we'll triple it in 10 years. You know, and then they want to add to this you know, a single-payer system that basically is going to cost an arm and a leg and won't do the job anyway.
Senator, nice to see you, sir, and likewise enjoy your recent. Yes, sir.
Could I say one other thing? You know,
yes, sir.
Why would we throw out a system that 85% of Americans have and basically approve of, and exchange it for 47 million people? By the way, of that 47 million people, when you deduct the ones who could have insurance through their employers but don't, you conduct 11 million that basically qualify for CHIP or Medicaid but don't realize it or are not enrolled. You deduct those who are over $75,000 a year in income but just won't purchase their own health insurance. And then 6 million people are illegal aliens. My gosh, when you put that all together, it leaves about 15 million people. So we're going to throw out a system that works for 15 million people.
We can help. Senator, thank you, sir. Thank you, sir.
Okay.